Can you recommend a pre-PET scan protocol that would help minimize the damage caused by the scan? So those of you that are getting, and that's RM's question. So those of you that are getting a PET scan or scheduled to do a CT know that you're going to get hammered with radiation. So the question is there a nutritional protocol on the front side of that you can front load to help reduce the potential for radiative damage? Yes. Well, first of all, I would say we'll get to your answer, but I will say this first. Question why you're getting a PET scan, question why you're getting a CAT scan. A lot of doctors want to do these scans and they're not always necessary. Sometimes it's overkill. And where an ultrasound might be enough, or a less radiative procedure might be enough from an imaging perspective. But as a business model, PET scans and CT scans pay the bills. They are very expensive, and they can bill your insurance for a lot more than say other imaging model types, like an MRI or even an X-ray or an ultrasound. So that's always a question I like to ask when somebody's making that recommendation. I actually had several. This is probably, well, I guess it's been almost a year now, maybe a year. I was advocating for a family member in the hospital, and anyway, it was in the urgent care facility, and I wanted to do a CT scan of her brain, and they hadn't even examined her yet. They hadn't asked her any questions. They just simply wanted to do a CT scan just because. Which, if you're in an ER, a CT scan is about $20,000 billable to insurance. So, my first question, they rolled into bed to take the patient away to do the CT scan. So I'm like, wait, what's going on? He's like, well, we've been authorized to do a CT scan. I said, by who? Well, the doctor. I said, doctor hasn't been in to see the patient yet. You should probably make sure that happens before you order a test that delivers a tremendous amount of radiation unnecessarily. This isn't something we need a CT scan about. There's a whole different kind of problem right now. This is a blood sugar problem, not a CT scan problem. Anyway, I had to chase the CT tech out. Then I had to chase the PA out because the PA came in and tried to bully us. And then the doctor finally came in. And ultimately, I chased the doctor out. I said, doctor, when are you going to do the exam on the patient and actually qualify this person that may or may not need a CT? I don't think they need a CT. Anyway, the doctor started to do the exam, and I watched the doctor do the exam. And, not to be a horrible critic, because I know they're busy and they're trying to do their jobs, but this doctor didn't even know how to do a neurological exam. So to me, what that said is that we have a very busy ER where people who aren't qualified are running around doing things and ordering things that aren't necessary, and that's a red flag. Anyway, long story short, what things can you do to protect yourself from the radiative damage if you absolutely need one of these procedures? I would give you 4 things to consider taking. Number 1, glutathione. Preload with glutathione for a week. About 500 milligrams a day would be a good amount to consider. Number 2, preload with vitamin C. About 5,000 milligrams a day for a week. Number 3, alpha lipoic acid. Preload with about 800 milligrams. And then number 4, preload with tocotrienol, which is a vitamin E antioxidant. Very powerful. So these things all work together to support your body's ability to combat the type of damage that occurs from these forms of radiation therapies. So doing those things about a week before loads the body, and then about a week after is, for any lingering effects, it's going to be helpful to support your body's ability to get through that, hopefully with less of a problem. Now, if you're doing any kind of dyes, if they're injecting any kind of radioactive dyes, which oftentimes they do on these scans, you might want to consider using, we have a product called Ultra Metal Detox. And it's what I use when we have people going in for these types of procedures. It's generally what I recommend in our practice. and I'll put a link in for you here on that particular product. But it's a mix of different things that help the body metals, and which is what many of these dyes are derivative from. So using this as a prophylactic and preventative, and even after the fact, we've seen people that went in for studies still have the radioactive metal dyes in them 10 years later, 15 years later, 20 years later. Some people are really good at removing these things and others are not. And this is where, that extra layer of nutritional support on the tail end or the front end can go a long way. And I'm going to put a link in the feed for those of you watching that want to check that out.